approaches to her lip. And in the end, it was stunning. She was significantly more symmetrical, which symmetry is not a real thing anyway, but it was hiding the scar. And that was not even our goal, but being a little bit creative.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Ashley DiMiola, owner, medical director, and on-site physician at Glow Aesthetics in South Burlington, Vermont, where she combines her deep knowledge of facial anatomy with advanced training in injectable medicine to deliver natural, confidence-boosting results. With over 15 years of medical expertise, she previously served as a senior flight surgeon and occupational medicine director in the United States Navy before transitioning into medical aesthetics. Dr. Ashley is certified in advanced filler techniques by the International Association for Physicians in Aesthetic Medicine and is committed to ongoing education to stay at the forefront of non-surgical aesthetics. Her patient-centered approach, warm demeanor, and meticulous attention to detail has earned her a reputation for creating results that are both beautiful and authentically natural. So Dr. Ashley, welcome and glad to have you here.
Hi, thank you. Very glad to be here.
Yeah, so let's dive right into it. I'm curious, how did you first get interested in medicine?
Oh gosh, medicine is a little bit trickier. When I was in college, I really was very interested in virology, the study of viruses, and I thought I might want to go into medicine. And a very true story is my pre-med advisor actually told me I would never become a doctor. And I think a lot of physicians have these stories, and it really lit a fire under me and made me push to make sure I made it into medical school.
Okay, and so then you served in the Navy for some time, and then after you got out, you made that transition to aesthetics. How did you end up deciding that you wanted to go from, I guess we go from virology to then becoming a doctor and now moving to aesthetics? So it's kind of this interesting path you took. So what was that jump when you decided to go into aesthetics? Like what caused you to want to do that?
So that's actually an even longer story, but we'll make it very brief, I promise. As a third year medical student, I was in a rural emergency room, and the emergency room physician actually owned one of the very first medical spas in Virginia. And I found his work fascinating. I would work my ER shift, and then I would go run over and just shadow him. I was so enthralled by what he did. And then aesthetics medicine doesn't really exist in the Navy. And so in the Navy, I was very much a concierge doctor to pilots in the air community, had a fantastic career. But the minute I had the opportunity to break into aesthetic medicine, I did. It's been a lifelong dream, and I'm really proud to be where I am.
Okay. And so now that you have this medical spa, the aesthetic medicine practice, I want to talk a little bit more about the treatments that you provide. So what are just some of the most common treatments that you would say that your clients and your patients come to you for?
I would say we are a very standard medical aesthetics practice in the sense that we provide Botox and filler. We do certain laser treatments, light resurfacing, broadband light, laser hair. We kind of provide the entire gamut to include some soft services. I have some estheticians, so hydrofacials, called classic facials like that. Vermont's a very interesting market, though, because it's a very understated market. So being from the South, all of this is very popular and has been. I've had Botox in my face for 20 years, but here it's a very secret community. And so it's really a privilege and a pleasure to serve Vermont because I have to do it in a really subtle way.
I see. And there's actually one treatment I really want to dive a little bit deeper into was liquid rhinoplasty. Now, I think some people have heard about rhinoplasty, but I don't know if many have heard about liquid rhinoplasty. So could you explain what is liquid rhinoplasty?
Sure. So liquid rhinoplasty is a fan favorite in Vermont, but it's also my personal favorite. I have a liquid rhinoplasty. And so it allows the non-surgical treatment of a profile issue or deformity. Typically, we see like a dorsal hump or a down-tipped nose, and I can actually use filler to soften that. And for the people that choose to go forward with it, to include myself, it's very game changing. It changes the way we see our face, how we believe other people see us. And so it's one of my favorites.
Okay. And has the liquid rhinoplasty been around for a while, or is it something that is relatively new?
I would say the liquid rhinoplasty has been around for a while. I would say it's less commonly performed. It's actually probably one of our riskiest procedures that we do in aesthetics medicine, and so I actually do not delegate to any of my injector staff to do that procedure. There is a risk of blindness, and so we're very, very selective about who we perform this procedure on. And because I'm concierge, we provide really close follow up after to make sure everything goes smoothly.
Okay. So what would be a situation where someone's considering this or comparing this to the surgical side of it? So you mentioned it's non-surgical. So I'm sure that the recovery is a lot faster, the implications of it, potentially things going wrong is a lot less. But could you kind of give me from your professional opinion, what's the difference between your surgical rhinoplasty and a liquid rhinoplasty?
Right. So this is actually something we do tease through. And if I'm going to reject a client, it's typically because they would require a surgical rhinoplasty and that's their only solution. I do sometimes have young clients brought in by their parents for this. Completely off the table. They're directed to surgeons for surgical rhinoplasty. Anybody that's ever had a surgical rhinoplasty, off the table. They go back to a surgeon just because the anatomy changes after surgery. People that are looking for changes in the front profile, so size changes, surgical rhinoplasty, not liquid rhinoplasty. The liquid rhinoplasty is really meant for those looking just for that very, very subtle profile change. And really that's it. It's probably the biggest conversation we have in the room is should you go with surgical or non-surgical? And it depends on patient goals, patient history, and I mean, very honestly, even their ability to recover.
Okay. So is it something where it's kind of you do one or the other, like they're kind of in two different buckets, or is it one where it's like, hey, take a look at the liquid rhinoplasty first. If that doesn't work for you, then you have to do surgical. So then kind of the liquid rhinoplasty is that first step, and then they go to the next one, or are they completely separate? It just depends on the situation.
I would say for me, they're completely separate. If they are at all, and this actually goes for my entire practice, if somebody is on the surgical spectrum, I keep them in a surgical category. We have some fantastic plastic surgeons that we collaborate with all the time. And so if they are a surgical candidate for a rhinoplasty or a facelift and they're interested in that route, then that is where they go. It's where they'll get their most perfect result. I mean, it doesn't last forever. Nothing in medicine lasts forever. But a liquid rhinoplasty is really meant for those that are not on the surgical spectrum at all, not able to afford a surgical rhinoplasty, terrified of anesthesia, and or just looking for a faster recovery.
Okay. And for the liquid rhinoplasty, is it really about putting filler into the nose to kind of fill in those areas, or exactly how does it work?
Right. So it's one of my procedures I actually do from behind the patient. So it even when we film it, it's very it's dynamic. And so we're looking for profile deficits. So the dip in the dorsal hump or the lift of the dorsal hump. And so we actually put filler all down the bridge of the nose here. And then sometimes in the tip, it just really depends on what the patient's goals are. But liquid rhinoplasties are very, very subtle. I would say most patients, their family, their friends have no idea I've ever done it.
Oh, wow. Okay. So it is
Mhm.
something just looking for that small change, but it's not so much that it's like, oh, I want to get a surgical rhinoplasty done.
No, if they have such a big change, I will always direct them towards surgery.
Okay. And I'm sure you get this question a lot. Is it painful?
That's actually very fair. I get that question a ton. I use topical numbing.
Okay.
So I do not like, I don't mind putting needles in people's faces, but I personally don't enjoy needles going into me. And so I try to use all the tips and tricks to make it as comfortable as possible. So all of my clients for filler are offered about 30 minutes of topical numbing just to make it comfortable. And then all of our syringes have lidocaine in it. So even as we go, it becomes more and more tolerable.
Okay. And what would you say are some of the most common myths or misconceptions people ask you about when it comes to liquid rhinoplasty?
Oh gosh, everybody thinks it's easy, fast, safe, and lasts forever. And that's
Perfect
really none of,
combination.
yeah, exactly. It's none of that. The procedure does take time. It's a very delicate procedure, again, a very delicate area. They do think it's going to last them 10, 15, 20 years forever. And that, again, unfortunately, that's nothing in aesthetic medicine or regular medicine or plastic surgery. Everything has an aging process.
Okay. And how would you compare the liquid rhinoplasty? Because I mean, in essence, my understanding of it is you're basically putting filler into the nose. How would it compare to like putting filler in the lips or just other areas? Is putting lip filler in a lot easier because of the area, or is it just as complex, or like what's the difference between putting it specifically in the nose compared to other areas of the face?
Sure. So that's not, I mean, that's almost a trick question. I've been doing this now a very long time. And so most of my areas to me dynamically are fairly standard to treat. And so for me, there's no additional complication of a nose versus cheeks or a jawline or lips or a chin. The risk to the patient, the risk of the procedure is what makes liquid rhinoplasties so much more selective. When we choose a cheek patient, I am only going off of visuals, and then we go through the consent. If I'm doing lips, we discuss the swelling and the bruising. But when we do liquid rhinoplasties, I'm significantly more selective just because it's such a risky procedure.
Okay. So I guess if we can compare it doing the liquid rhinoplasty versus like putting filler into lips, the process is similar. We're using the putting the filler in, but the level of skill set is significantly higher because is it the risk of complication is a lot higher as well?
Yes, and if a complication were to happen, it like you would either kill the tip of the nose or possibly go blind. And I mean, blindness would be an occupational injury. And so,
Wow.
yes, whereas lips, yes, vascular occlusions with filler can happen at any point. And we all read and hear these terrible stories. I can only speak for my own clinic. I can't speak to anybody else's, but we have a very thorough vascular occlusion protocol. We check as we go. My injectors actually undergo rigorous training before they ever put a needle in any of my patients' faces, just because risk is part of the medical aesthetics game.
Okay. So then let's say someone is looking for getting a liquid rhinoplasty and they're looking around for a provider who is really good at this, has that high level of skill. What would you say is the most important piece of advice you can give to someone like that as far as who to choose, who to go to, and who to ultimately have do this procedure for them?
So I strongly recommend physician injectors, and I work with some fantastic nurses, PAs, and Ps. I recommend physician injectors for liquid rhinoplasties. The complication rates, the complications, if they are to happen, are very significant. If you're going to go to a provider for liquid rhinoplasty, look at their before and afters, figure out how often they're actually doing this procedure. Always have a consultation. Consultations for liquid rhinoplasties are mandatory in my clinic, because I have to screen the client to make sure that our goals are aligned, but that they're even medically indicated to receive it. And so I wouldn't go to a place that's doing a buy one, get one syringe and get a liquid rhinoplasty while you're there. It's a little bit more in depth than a lot of the fillers that we do.
Okay. So as far as easy red flags, one would be that price point. If it's just like a quick, they don't put much priority on it, then that's a red flag. Or if it's like a buy one, get one, then it's probably also a red flag. Are there any other red flags you can think about as far as what people need to be aware of with this?
I think in my industry, there's lots of red flags. I do. I think how intelligently they can speak to you about the complications, how they're going to handle a complication if it's going to occur. If they do not provide after hours care, that is not somebody you should be going to really for filler of any sort, let alone a liquid rhinoplasty. Because if we're going to have complications, I, I doubt they're ever going to happen on hours.
Mhm.
And so if you were to get a liquid rhinoplasty on a Friday, but they're closed until 10 a.m. on Monday, what a disaster.
Yeah.
And so I think a qualified provider, knowing their own history of the procedures that they're doing, like the numbers and all of that, but also understanding their emergency plan and how they would take care of you if anything were to come up.
Okay. And then I'm curious, when it comes to the filler that's being used in the liquid rhinoplasty, is it different from the filler you would put in the cheeks or the jaw or lips, or is it the same filler? It's just how you apply it is different.
Yeah, yes and no. Yes and no. Every filler has a different density. To patients, I describe it as like a thickness or sometimes even just a texture. We use a very thick filler in the nose. There's actually clinical studies that tell us exactly how to apply filler in a liquid rhinoplasty, how much we can inject at a time to decrease our risk of complications. And so I try to get my best bang for my buck in how we get the filler in. So I pick a very thick filler. It also tends to last a little bit longer. When people ask about duration, it's always that complicated thing in medicine. Well, I don't actually know,
Mhm.
but my goal is for patients to get anywhere from 6 months to a year off of their liquid rhinoplasty, their initial one. Typically, follow ups get 2 to 3 years after.
Okay. And then going back to that, to the red flags as far as what people need to be aware of if they're looking to get this type of treatment, is
Mhm.
the quality of products something that they should be aware of? Like the quality of the filler. We kind of talked about there's different types of fillers, but then even the quality itself, is that something that they should keep an eye out for? And if so, how do they do that if they don't know anything about what this product is?
Yeah, so it's less common here in Vermont, but I do actually hear about this elsewhere in the country. There are counterfeit fillers. So my all of my products are actually opened directly in front of my client. I don't go into a back room or prep. I make sure that they're aware of each quality step as we go. I think that that's a trickier thing in the industry is to between brands. I don't have a brand preference. I don't believe I ever will have a brand preference. I use mostly Juvederm, but that doesn't make it a superior brand. But quality and red flags, you need to go to a reputable place. I mean, we're hearing these stories of people bringing in filler from not great places and injecting it into people. And in fact, I do have a story of a patient that came to me on a Saturday. Her husband called me because she ordered 30 mLs, 30 milliliters, 30 syringes of filler off of like Temu or something and self-injected at home.
Oh,
I was glad I was open on a Saturday. It was
yeah.
pretty. So go to a quality place, read our Google reviews, come meet us. I always tell my clients, especially even when they're moving, I say read all the Google reviews, but then go interview them. Make sure it's a good fit. Make sure you trust them.
Wow, that's incredible. Yeah, I guess people try and go the cheap route, but it can actually lead to some serious health consequences if they try and go cheap.
Yes, this particular patient, she actually injected all 30 cc's, 30 mLs into her face. And she's so lucky she didn't go blind. But to get rid of it, it took all the Hylenex in my clinic.
Oh,
We had to
wow.
overnight my reversal agent.
Oh,
It was pretty dramatic. And so go to someone reputable.
yeah, yeah, you don't want that happening to you.
No, no.
Okay. Now, I want to talk a little bit more as far as your approach. You have this approach called low and slow. Could you explain what is this approach, low and slow?
So low and slow. And the art, at least in Vermont, is again, it's very different than the rest of the country. And actually, Europe, this is very much a European standard now, is that it's the less is more, that we pick the lowest dose that we think will start to achieve your result. And then we tailor your treatment over time to hit your visual goal. The benefit of going low and slow, or subtly, is that we actually have psychologic studies that show you and myself forget the fine details of your face 10 minutes after you last saw it. And so if you're forgetting the fine details of your face, if I'm forgetting the fine details of your face, the lower and slower we go, we're so less likely to fall into filler blindness, perception blindness, body dysmorphia, facial dysmorphia. And it's because we're really just tailoring the treatment to your exact goals each time we see you. So I go low and slow really to achieve a really natural result that hopefully, again, you and I notice. But my hope is that in case your husband doesn't know you're in my clinic, that he also doesn't notice.
Okay, got it. And I'm curious, what role do you believe that creativity plays in how you approach patient care? Because I think you have a very unique background as far as you have that interest in virology and then going into becoming a doctor and then getting to the aesthetic side. So, what role do you think creativity plays? I don't think that's something that people think about when they think about medicine as far as creativity. That's not the first word that comes to their mind.
That's actually a really interesting question. I would have told you 15 years ago I was never an artist. I have so many wonderful creatives in my life, and I feel very blessed for that. But I would have never. Creativity is the name of this game. You have to be able to look at the face with an artistic eye, and it's all lights and shadows. It's listening to what they're saying to you, and then finding a way to highlight or even sometimes subtly hide the things that your patient's saying. And so it can take a really creative approach. I'm trying to think of some cases, but even just recently, I have a client that was bit by a dog, and she had a scar on her lip. It had happened 2 years ago. She was very asymmetrical, and with scars, sometimes filler doesn't go as planned. It just doesn't, the tissue doesn't reflect the same way. And so we just kind of took this approach of we're going to try our best to hit your goal. And we kind of took these different approaches to her lip. And in the end, it was stunning. She was significantly more symmetrical, which symmetry is not a real thing anyway, but it was hiding the scar. And that was not even our goal, but being a little bit creative, being patient, communicating together, coming up with a goal together, we hit it.
Wow. Okay. So sometimes you have to think out of the box, especially when it comes to aesthetic medicine. It's not just completely follow the protocols. I'm sure in many situations you have to follow the protocols, but there's a lot of room as far as artistry, that artistic eye, that creative goes, correct?
Yes, within safety parameters always. But yeah, it's actually a really fun. I mean, again, you speak to beauty people all the time. Beauty is really, really fun, and it's because everybody's definition of beauty is different.
Very true. Now, I'm curious, Dr. Ashley, where do you think the future of aesthetics is going?
Oh, regenerative medicine, lasers, 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 lasers. There will always be a place in this industry for Botox. There will, or at least for the near future. There will always be a place in this industry for fillers. That's lights and shadows. You're depleting volume as you age anyway. Lasers. We have so many fantastic clinical studies showing that as we tailor laser treatments to people's faces, that we can actually all the way back to the genetic level start to slow down the aging of their skin. It's fascinating. Even this wellness industry, the peptides that are coming out, it's a really fantastic time to be a provider, a physician in the beauty industry.
Okay. And what about this trend? Maybe not as a trend, trend's not the right word, but people wanting to have more of that natural look. Is that something that you're starting to see more and more of?
I'm in a very different community. Vermont, I am an underground. I am an underground community. I used to call myself the black arts of medicine. Thankfully, it's becoming a bit more common in Vermont. I would say that subtlety is the way it should have always been. Looking just like yourself should have been the way it had always been. Those crazy lips and those bonkers cheeks, and even the witchy chin for a little while, all too much, all too much. And so I'm really happy that, at least as an American industry, we're really starting to follow what's been in Europe for a while now, which is just look like yourself, highlight what you want to highlight within reason, and otherwise just enjoy.
Okay. And you mentioned regenerative medicine. So I want to touch on that one really briefly. What is regenerative medicine in a nutshell?
Oh my goodness, what a big topic, right? And I think I think if you, I'm sure you're talking to other physicians and providers that are talking about this. It's almost like a little bit of a dangerous platform right now because they're like, oh gosh, PGF, like exosomes, what's real, what's not real, what's clinically studied, what's on label mean, what does off label mean, when should we not be injecting things into people's faces. Regenerative medicine is this really interesting topic right now, which is the idea that we want your skin's cellular health to be at peak performance. We are not taking you necessarily backwards. I mean, there are some laser studies that show that we possibly can within reason. But it's the whole idea that we can slow it down and put your cells at peak performance. And so we're seeing it in the GLP-1s with microdosing. We are seeing it in the peptide community with cognitive function. NAD, really an interesting topic. But in lasers, we do have some studies showing that genetically we can alter the function of your cells to help them perform in a more peak way.
Wow. Sounds like we're already in the future right now.
It's a really fun time. It's a really fun time.
Okay. Now, with your practice, Glow Aesthetics, what's your vision for Glow Aesthetics?
Oh, my vision. It's kind of been the same since the beginning, which is just to empower people. It's really a passion for me. I have such a love for what I do, but I think the reason I love it so much is that I can offer men and women this opportunity to feel like their very best version. I mean, sometimes that's as simple as Botox, sometimes it's complicated laser strategies, and sometimes it's just a GLP-1. But the opportunity, the vision for Glow is to continue being this positive, body positive, facial positive, supportive environment that just helps people get to their goal.
Sounds like a wonderful vision.
It's served us well so far.
There you go. Can't argue with that. Now, Dr. Ashley, I have one last question for you, but before I ask it, I do want to point people to your website at glowmedspavt.com. Now, my last question for you is, what does beauty mean to you?
Oh, beauty is in the eye of the beholder. What kind of question is that? My personal beauty is really based on lights and shadows. I think beauty is about highlighting what is most important to you, and that doesn't have to be necessarily your face. I think beauty is about celebrating what you find most healthy and loving and you want to celebrate. And so when people ask me about what I love about my job, it's lights and shadows. We can subtly take things, hide things if we need to, and we can highlight the things that are most important to you. So that's beauty for me.
Okay. Well, there you have it. Dr. Ashley sharing her expertise. So, Dr. Ashley, where can people contact you in your practice?
They can contact us either by text or phone call at 802-338-9599. They can go to our website where we have a chat bot, but I am still the chat bot, looking at my business manager to hopefully change that for me. But otherwise, they can email info@glowmedspavt.com. They can get us on our Instagram. They can get us on our TikTok. Any way they'd like, we will have somebody available.
Awesome. Well, Dr. Ashley, this is wonderful. Thank you for coming on. Thank you for talking all about what you do and also the liquid rhinoplasty, dive deep into that. And just thank you for sharing your message.
That was a lot of fun. Thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.